Hello, everyone. Welcome. You are more than welcome to keep your cameras off if you do not want to show your face, but if you do, we would love to see you. It's always nice to see who we're speaking to. Welcome. My name is Ashley Chilla. I am the Associate Director of Admission here at Emory School of Nursing. We're excited to have you here. Today, we're going to be talking about the family nurse practitioner specialty. And we have Dr. Pitts, who is the program director here, who's just going to let you know a bit of information about the program itself. If you have questions, we'll wait till the end for that. And so I'm going to let Dr. Pitts take over.
Thank you, Ashley. So, hi again. I'm Dr. Courtney Pitts. I am the F&P Specialty Director. I have been here since August. I just started this, not this August, but August 2023. And this is my second year as the Specialty Director. I have served in a similar role previously for 7 years at another institution, and I have an overall experience of about 14 years in nursing education. So I am an actively practicing NP. I serve those living with HIV and those of the LGBTQI community. So that's just a little bit about me um, before we get started. So I will tell you, my presentation is about 13 slides long. I give you the quick, the nitty, the gritty, and the dirty, and then I open up the floor to you so that I may answer any questions that you may have about the program, about placement. Usually that's the number one thing students want to know, and then about intensives. So I will get started, and let me make sure I can do this after 4 years. Let's see. And we will share. There we go. Ashley, are you able to see my presentation screen? Great. All right. So welcome to Open House, where you're here to get a little bit of information about the program. So without further ado, um, this next slide shows you a picture of our core members of our team. So you have me, you have Dr. Arthrine Abiri, who is currently serving as the assistant director. She is primarily in the DNP courses, and she does the intensive planning for our program. You have Dr. Allison Lepke. She's typically over the MSN program. And so you will see her in more of your MSN didactic courses and in some of your clinical courses. You have Dr. Heather Venrick. She's across both academic programs, the DNP and MSN. So you will see her mostly in your initial F&P class, so whether it be your diagnostic and reasoning class, or it's your first F&P didactic class. And so she kind of helps you with that application of all the information that you're obtaining in health assessment, pharmacology, and pathophysiology. And then there's the wonderful Mr. David Bell. And I usually tell him that he's actually the head of the program because he's over our clinical placements. And so usually he gets a lot of the questions that you all have. Um, and so you will meet all of these wonderful people later on if you happen to join our program. And so just a little bit about the scope of practice and the role. So the structure of the MP programs are based on what we call the APRN consensus model. And that model addresses the licensure. So when I talk about licensure, that's state licensure that's required from the Board of Nursing, accreditation. So the accrediting bodies that certify our programs and say that we can take students and that your degree means something when you graduate. Certification. As an F&P, you'll be eligible to sit for two national certification exams. It doesn't matter which one you take. We talk about that in the program. Once you complete the program, and then your education. Your education is this program. Understanding that you provide care across the lifespan. So whether they say womb to tomb, birth to death, whatever the case, you see people of all ages, ethnicities, backgrounds, socioeconomic status. We cover it all. And then making sure you understand that you're working in a more stable setting. So the settings, some F&Ps, you may see them in more hospital-like settings, but understanding that is more about the patient stability. So we're not in acute settings, we're not in critical care units, we're not hospitalists, internists, persons of that nature, but we take care of critical, stable patients. And then supply versus demand. So I don't know how much you're following the trends of healthcare right now, but nurse practitioners are in high demand. And that's because we also have, not only do we have a nursing shortage, but we also have a physician shortage that is looming over our heads. And so just making sure that we can meet the needs of the public and provide access to quality health care. See if this will, there we go. And so just the distribution of MPs by primary certification area, you will see that FMP is the largest population focused MP that there is that's being educated and graduated. And so just as you see at the bottom, we need more than 325,000 MPs in the United States. And I'm happy that you're interested in becoming one. And so some of Emory's F&P program highlights, I need to update this for 2024, but the DNP F&P program ranked number 5, MSN number 6, so staying in that top 10 rank of programs across the United States who are educating our MP workforce. That's amazing. Most popular and largest APRN specialty program at the School of Nursing and at most schools of nursing. F&P programs are typically the flagship programs because of the ability to cover from birth to death, seeing those patients across the lifespan. We have a diverse faculty with extensive clinical and classroom expertise. I showed you the core faculty, and so those are the faculty that you'll see mostly threaded throughout your didactic and clinical courses. But what you will also see are other practicing clinicians that are out in the field who are serving as our site visitors. They're serving in our didactic courses, in simulation with us, so that you're able to get that clinical expertise, that feedback from people who are actively practicing, which is very important, right? And then also we offer a selection of plans of study to support student learning and welcome and to help you with work-life harmony. Number one, I rarely ever use balance because I feel like balance is never achieved, but I do say harmony because sometimes you can make that thing work together depending on the ebbs and flows of your life seasons. So we have, and I think I'll go into this a little more as I go through the presentation, but we have at least 2 plans of study for those of you interested in DNP, and then we have 3 plans of study for those of you interested in the MSN pathway. So program expectations, what you should expect is that your faculty, me, the core team, site visitors, STEM instructors that we're prepared and that we're enthusiastic about teaching you. We are actually very excited to have our students, right? And to get to know you. We love to see you all in person. That you have a safe and inclusive learning environment. I usually use a plug that since this may be disseminated widely and I don't want to infringe on copyright, I won't say it here, but you'll hear me say it in the program. But it's a safe zone to learn. If there's no other opportunity that you have to learn and to make safe mistakes, this is the time. And then faculty availability and accessibility. Most times we are able to get with you within 24, 48 hours if you need us. You don't have to hesitate to reach out to us. Even though the program is mostly online, we're still very accessible, whether you want to talk via Zoom, phone, or face-to-face. And then faculty expectations. The biggest thing that I honed in on is professionalism. Even though it's at the bottom, it's the number one thing that we really talk about with our students. Respectful interactions. I do not believe in incivility. I feel like we can all advocate for ourselves in a very respectful manner and to have conversations. In the field of healthcare, we won't always agree, but we can respectfully disagree at particular times. Faculty, we also expect you to be prepared when you come to class or clinical. We'll give you a heads up if it's intensives about what you need. And if it's clinical, we outline that before you go so that you're prepared and you're ready to have a good direct patient care experience. And then punctual class and intensive attendance. Nothing speaks more to professionalism than punctuality. And y'all, please excuse my congestion. I've been battling this for a week, so I'm sorry. I know I sound real nasally right now. So ultimately, we just want you to grow so that at the end of the program and at the conclusion, when you walk across that stage, that we know that you are safe and that you're competent as a novice provider. We don't expect you to know everything, but there are some bare minimum competencies that you should be able to meet throughout the extent of the program. So let's talk about the curriculum just a little bit because I know that, some may be making a choice between the MSN program and the DNP program. So one, we do offer both. Number two, no matter which pathway you choose, the content that you're learning is the same. The simulations are very similar. With DNP, we may take it up just a notch because you need that systems approach. And then ultimately, the difference that you'll see is the number of credit hours that you have to complete, the number of clinical hours, and then again, the plan of study options that you have. So if you look at MSN, the 4 semester plan for fall, that is our full-time plan of study. It takes 4 semesters for you from the beginning of one fall to the end of another fall to complete the MSN program. For those of you who would like to work, um, that we have the 6 semester plan and the 7 semester plan. The 6 semester plan you enter in the spring and you'll finish in the following fall. And then the 7 semester plan is basically 2 years. So with the DNP, we have a 7 semester program and a 9 semester program. The 7 semester is the full-time plan of study. Both of them have entry options for fall. We do not have a spring entry option for DNP. And so this is the biggest question. What do my practicums look like and when do they start? So if you look at the plans of study, you will see the clinical practical courses listed on your respective plan of study. But I've also listed them here as well for your reference. And so what you see is clinical practicum one that usually starts in the spring, no matter which, if you're MSN, and you go all the way through summer. So you have 3 semesters of clinical practicum with the number of hours increasing. With DNP, you start in the summer, you'll have 3 consecutive semesters where you will have to acquire 180 hours. And then your hours increase to 240 and then 360 in the respective summer and fall semesters. And I will also share another resource with you that outlines some more specifics about practicums as you plan. And so with the practicums, but based on certification, all students need a minimum of 500 clinical hours to be eligible to sit for certification in the family setting or the primary care setting. So if you're in the MSN program, you need 780 hours. 500 of those are primary care. The other 280 you can do in a specialty rotation, something that is of your interest. DNP actually has 680 hours, and that's because most times we have DNP students do their 500 hours up front, but then you do those last 180 hours at the end to kind of circle back and bring things back into the loop so that it's fresh for you when you sit for certification exam. And so here's a list of some of our specialty care rotations that students typically complete. I will just let you know, and I think I'll go over this on the next slide. It all depends on the availability of specialty care rotations, or if you have connections to a particular specialty rotation, you're able to, we can help you arrange that as well. The specialty care rotations have to be within the F&P scope of practice, have to be. So sometimes students will bring us rotations in plastic surgery, in aesthetics, depending on the level of aesthetics, we may approve it, but for the most part, they need to be stable patients, just as you would see in primary care. So if you're very interested in managing diabetes and honing in on that skill, you can do an endocrinology clinic. You can do a heart failure clinic, an ortho clinic. The sky's the limit as long as your patients are stable, and that is within our scope of practice. And so things that you need to be mindful of. The first thing that I really want to stress is that you will be required to lead the effort in securing your own clinical site. And I know historically the specialty has been responsible for securing those sites. I will be honest, it's more of a 60-40 effort now. So what we do have is we have a tool that we share with admitted students so that you're able to see what affiliations we already have. And then if you're interested in those, you'll let Mr. Bill know. He'll connect you with those placements to see if we can secure it. Sometimes students have their own idea of where they want to practice, and so they secure those placements on their own. And so we just help with that process. So just understand that you will be responsible for leading that effort and securing your own placement during your time in the program. But we are here to help. Traveling to a clinical site may be required. Whether you're in state or out of state, if you're in the metro Atlanta area, please understand that you'll still probably have to travel at least an hour to your clinical site. If you are out of state and you're in urban areas such as Chicago or Boston or Dallas or Houston, those placements are also hard to secure because of competition with other professional schools. So you may also have to drive in those instances as well. I highly suggest that you start looking at more mom and pop or privately owned clinics for your clinical practicum needs because they're easier to secure those affiliation agreements. So that's just a tip on that process. So also make sure that you have reliable transportation because again, it will require that you travel during the course of the program. Let's see, to complete your practicums before the end of the semester, you may need to attend clinical a minimum of 3 days a week, depending on the semester. And again, I will share a resource at the end that will help you kind of map out per semester, per clinical rotation, what you will need as far as days off, because I know some students are working and you have to balance your work schedule with your clinical schedule. And when you're working in primary care, even though you're doing 12 hours maybe on the floor, you still need that 8 to 5 day to get your hours done during the week. So just knowing that you'll have to be able to kind of switch things up. You may have to go to part-time, you may have to go to per diem. If you have to work full-time, I would absolutely suggest that you do a part-time option as far as the plan of study. Let's see. Placements differ each semester based on clinical site and preceptor availability. So that's just saying that you may reach out to a preceptor, we may reach out to a preceptor. If they are unable to take students, then that's not a site that you can go to. You'll have to continue to try to secure another site. We cannot force preceptors to take students, even if they're with Emory Healthcare. So it's best to start early. Specialty care rotations. I mentioned those earlier. One thing to note is that number one, they cannot be guaranteed. Again, sometimes those are in high demand as well. But more specifically, if you have not met competency in your primary care, specialty rotations may not be approved. So you have to be competent in what you need to sit for certification before you can move on to specialty rotations. How often does that happen to students? Not often, not often. Most students are able to participate in specialty care rotations. And some students opt out and they just decide that they would rather do primary care instead. So there's that option. One of the common questions is how long can I stay at a site? And so only a maximum of 360 consecutive clinical hours can be completed at a site at a time. So if you're a DNP student and your first two practicums are 180 hours, then you can stay at that site for 180 hours. I mean, for 2 semesters. If you're MSN, that's more like a semester and a half. And we do that for two reasons. Number one, you need diversity in your training. You need to see a different population. Number two, as a preceptor myself, they need a break. Okay. And I know you're like, oh, this site is wonderful and I want to stay here the entire time. just give them breathing room. Give them a break. Because as much as they like to give that service back to the profession, it can be a bit overwhelming and it can burn out a preceptor pretty fast. And so I have a lot of these conversations close to midterm of the fall semester about working. So students, of course, think, oh, I can do it all. And then life takes off, right? And I'm not saying that it's not impossible to work full time and to go to school full time. I'm just saying that that is a heavy load, especially if you're taking pharm, pathophysiology, health assessment, and the diagnostics course. You may start out strong that first month, and then it'll start to kind of wear on you. And that's the conversation that I've been having for the past week with some students about dropping to the part-time plan of study, only because it's a lot. So I would just say be very realistic about your support, and whether or not you can really do both full-time work and full-time plan of study in school. Because even though we may know you work, when it's time for you to be at intensives, we expect you to be at intensives. If you're supposed to be in clinic, we expect you to be in clinic. Okay. So another thing is that if you're completing a nurse residency, part-time is highly recommended, because the load there is heavy as well as the load of the program. And we tend to see students burn out. And so that is the end of my presentation. But what I do want to do is drop in a resource for you really quickly in the chat. Let's see if I can get this together. Me and technology, I tell you. Let's see if yes, there we go. All right. So what I just dropped in the chat are the placement guidelines based on the academic program. So whether you're a DNP student or an MSN clinical placement student. So say for instance, if you're the MSN clinical placement, um, you will see, let's see, it's still trying to do, you will see at the top of it, um, the practicum course is broken down, and I'll share that really quickly. So at the top, you'll see the practicum course, what rotations are required for that particular course, how many hours are required, and what we recommend as far as how many days of clinical you should attend per week so that you're able to meet those hours by the end of the semester. If you are in a summer clinical, so say for instance for FMP, for MSN, that's the second course. You have a much shorter time span. So even though it doesn't look like a lot of hours, you really don't have as long as the 15-week semester. You have about 12 weeks to get it done. So just be mindful of that. The only other thing is we've answered some common questions about who can precept you. It can be an NP, PA, DO, MD, as long as they're within your scope of practice. You must have your license. We outline what primary care rotations are, how many hours for telehealth, and then we break down that 500 hours about what that 500 hours could look like for you. And then how many hours specialty rotations can be. Let's see. So I think we answered a lot of the main questions. So please take this resource. We just updated it today and it will be updated on the website as well. And if you have any questions about that, feel free to shoot us a message. I also see Mr. David Bill, the infamous Mr. David Bill, has entered the Zoom chat. So at this point, I'll take any questions that you have about the program. Hi, Mr. Bill.
Hey,
Hi again, Ashley. Hi, Dr. Pitts. Thanks so much for the information. My name is Carrie. I am curious about the opportunity to get clinical hours working in some of Emory's international clinics.
So what we do have is a collaboration with the LCC, the Lillian Carter Center. And so students are able to go on some of those initiatives and acquire hours. There's also one during the summer, Mr. Bill, Moultrie, um, farm workers that students go for 2 weeks. And typically that's where students get a lot of their PEs. So if there is an international trip, there's usually during the intensive, Dr. Downs from the LCC will come over after we've talked and we've approved which immersion students can go on. And so there are those opportunities.
So this year they were talking about Peru, Dominican Republic, um, the Moultrie program where they do the farm workers. Um, I think there's a new one they're working on, but they haven't announced it yet.
I think so too. I think they're going to introduce it to this current cohort. And there are a number of fellowships that students can participate in. So if you see that are tied to the program, so if you see the Fold Fellowship, which is the palliative care fellowship, you have Emory in Motion. We have those students. We have Van App students who work with veterans. So any of those programs, you're also able to participate in those and get credit towards your clinical hours.
Wonderful. Thank you. As a follow-up question, for those who are not located in Georgia, are the costs for coming to Georgia for intensives included in program costs, or is that something that we need to be budgeting for separately?
That's something that you need to be budgeting for separately. What I will tell you is typically intensives are once a semester for no more than 3 days. We try to keep it down to 2 days if possible, but once a semester for about 3 days, max. And we try to get that information out to you like 3 months in advance so that if you need to purchase plane tickets, you can. If you need lodging, you can do that as well. So yes, it is an additional cost. And I'm trying to think, yeah, that's about it. Because everything else is synchronous. If it's something else where you have to meet as a group, it's synchronous online.
All right, thank you.
No problem. Thanks, Carrie. Any other questions?
On the international question, I did have a student last year that decided that she wanted to do a clinical rotation in Africa and had a company in England that found her a preceptor. So that's a possibility too.
And the only thing is we just have to make sure that whatever you're doing will be at the APRN level. Because some countries internationally, they don't have the NP role. So we just have to make sure that you're good there. We don't want you to waste your clinical hours. You thinking that you require clinical hours and you were more so functioning at the RN level. Let's see. Kiera said, how soon after applying for DNP can we expect to hear about a possible interview and decision thereafter? Ashley, did you want me to jump in? I will tell you, we don't do interviews. It's everything you put in the application.
Yep. So there are no interviews for the DNP. As for deadlines, if you look on our website, we have 3 deadlines for every program that we have for whenever you are applying for whatever semester. And then there is also a decision deadline. So whenever you apply, look for what the decision deadline is for that particular date. All decisions go out on that decision deadline. So they all get sent out at 5 o'clock. It's usually on a Sunday for that particular round.
You're welcome. Any other questions?
Hello. Hello. My name is Chinaza. I was wondering, what are some of the different expectations for being a DNP instead of an MSN, such as like contributing to research or doing our own research project? Is that something that we also do in the School of Nursing?
So it's more so a translational project. So DMP is not research-based. It's more so about quality improvement, translating the body of knowledge into practice, right? Making things better, improving patient health outcomes. So what do you expect? So as far as the F&P curriculum, the F&P curriculum is the same. So what you're being taught as a nurse practitioner is the same. However, your core content as far as MSN versus DMP, MSN will get that MSN level like theory. Everybody gets the three Ps. And they will get some innovative leadership, policy courses. You will get some as well, but you will also get courses like quality safety. And then you will complete a DMP project at that time. So you'll state what your interest is, and then you'll be paired later on with faculty who are able to guide you through that DMP project process. So there's a little bit of difference in your didactic courses. Your practicums will be the same. Your F&P courses are the same, but then you'll also have to do a DMP project that you have to implement.
All right, thank you.
You're welcome.
And I would encourage anybody who's on this call or listening to this call later on from YouTube, we do provide the curriculum, a PDF of the curriculum for the MSN, for the DNP, both full and part-time. So you can go on the website, find FNP under the particular program that you're looking for, whether that be full-time, part-time, and you can find the PDF that will show you exactly what classes we expect you to take per semester.
Yes. And for DNP, I will tell you, you don't see FNP until your third semester because you're taking your core DNP courses, the core courses and the core clinical courses. And so we don't see you until that summer. You're admitted in the fall. We see you for the first time in the summer. Anything else? No question is a silly question.
Sorry, I'm in the break room.
Yeah.
But when you were talking about the clinicals as far as them starting in the summer, is that to assume like the summer after we start, like we start fall 25, it would be that next summer, not like the
Yes,
summer before, correct?
right.
Okay, I just wanted to make sure.
Yeah, yeah. I think I had the wrong dates on there from a previous, it might have been open house last year, so sorry. Um, but yeah, so if you start fall 2025, you have to take your three Ps and your core DMP courses in the fall and the spring, and then summer is the first time you'll hit the clinical setting. Thanks for the clarification. Okay, all hearts and minds clear? It takes me 48 hours to answer emails. Okay. I'll turn it back over to Ms. Ashley.
All right, thank you all so much for joining us. Again, if you do have any questions later on, our information is available online. nursingquestions@emory.edu is the admissions email address where you can contact us about the admissions process if you have any questions about that as well. And thank you all so much for joining us. Thank you, Dr. Pitts. Thank you, Mr. Bell. We appreciate you being here. Have a great day.